everything that you do, you're looking for what their range of motion is. Now, a hard stop in a range of motion means the brain isn't going to allow you to go further. It's called neurological tightness. Whereas a slow stop at the end of range of motion is a mechanical tightness, which means the tissue is tight, mechanically tight. The brain's fine. It knows you have that range, but it's just tight, okay? And I'm going to show you how to deal with both of them. Now, when I hold your feet, your hips are very tightly in external rotation. As I put a little bit of pressure moving your toes inside, they don't want to go. So I know you have a lot of external rotation, and really it's neurologically tight, which means they don't want to internally rotate. So I know just from the beginning that we're going to work on internal rotation. Okay, so I'm going to see here, you have pretty good external rotation. You might have some sensitivity on the inside of the knee because these muscles are stretched a little bit long. So you never want to go in really heavily, does that make sense, at first? Because you're calming the nervous system down. If you go in, if I put all my weight here on you, your nervous system is going to say absolutely not. And then we're done. Do you know what I mean? We're not going to accomplish anything good. So I'm going to hold most of my weight with my body, but I'm going to let a little bit. Does that make sense? Now, a little bit of discomfort is okay, but we don't want to go into pain and excite the nervous system. Now, each thing that we do takes time, right? So you could go through each of the positions and stretches quickly, but we won't accomplish a whole lot. You can't stretch a muscle in less than 2 minutes. So I'm going to work with the tissue. Does that make sense? Now, in this position, you can feel on your left leg discomfort on the back side or the front. Which do you feel?
In the front.
In the front.
And when you're up here, it hurts.
Yeah, those adductors can be really, really tender. So I'm waiting for the tissue to soften. And that just doesn't happen fast. You can kind of tell when the tissue, the texture changes a little bit and softens. I know that this muscle here, TFL, is tight. And so I know that we're going to spend quite a bit of time working on it. I also can tell that your quads are really tight. So we're going to spend some time there too. So I'm going to bring this leg out.
So you said like you start at the bottom versus like the top of someone. Doesn't matter.
Everything you do is going to change how the neck is. So I like to do the neck last. Does that make sense? Mm-hmm. So I'm feeling especially the attachments. So you have tendons that attach from the toes clear up to the knee and then above the knee. So you're going to spend extra time on around the knee. Does that make sense on those muscle attachments? Now, I'm also looking to build more internal rotation into. And if you have runners, probably that's going to be what they need too, is more internal rotation. So I'm going to also spend some time on the outside of the knee in those attachments. And then I'm going to, so I'm right above the kneecap, and I'm going to just press up on the quad, giving a little more space for the patella. And then I'm going to put as much pressure through their quads as they can handle.
You gotta do more than that.
Okay. The way that you'll know how much you should put in is you're going to watch their face and you're going to watch their breathing. If they're holding their breath, that's not a good sign. So that's how you know, because if you're putting too much, then the muscle will do the opposite of what you want it to do. It'll get tighter and not looser. And again, you're looking for tissue texture change. Okay. So I'm going to, okay, so this is internal rotation. We should be able to bring your knee way across midline to the other side. So automatically I know we're going to spend so much time on your lateral hip rotators and so much time on, so you have lots more external rotation and you have almost zero internal rotation. So I know that is where we're going to spend the most time.
When you're saying rotation, are you meaning the foot or the knee?
I mean the hip. So when the knee passes midline,
Okay,
then your hip goes into external rotation.
gotcha. No, the reason I was asking is because her feet naturally do this.
Yes, that's external rotation of the hip. A lot of people do that. Most people, some more than others. It causes a lot of problems. If you can't internally rotate your hips, then what happens is,
Oh, that is my hips that are changing, not my,
yes,
not my ankles
no,
so much. There's a little bit.
a little bit. But if your hip can't internally rotate, then what's happening is you will move the whole pelvis to walk, which puts a ton of strain on the SI joints, and it also causes each of the the lumbar vertebrae to move lateral side to side more than they should.
Which is sciatic and
Yes.
those vertebrae that you have to get fixed.
Yes. So, yeah. Okay.
Makes sense.
So now tell me what you're doing.
Okay, so I'm going to start with my foot on your sit bones, but I'm kind of high. Can you feel that? Now each time, so I'm on your hamstring attachments, and I'm going to move, my foot will slide down further every time I move your knee up. Does that make sense? So my foot isn't moving. Well, kind of it is, but it's moving because you are. Does that make sense? Okay. Yeah, this is not going to be comfortable. I will tell you that we have to stretch your lateral quad, your vastus lateralis and your TFL. And you should be rolling this out every day. Like it's pretty far developed that you need a lot more length on your lateral quad. It's going to do a lot of damage to your low back and your SI joints. Sounds like it maybe already has a little bit.
A lot of it.
Yeah. Okay. When someone has an area that's really painful, like you have, then the best thing to do is, I'm going to have you push your knee into my arm, is to have them engage that muscle. Remember, you cannot stretch a muscle in under 2 minutes, and 2 minutes is longer than you think. Okay. So a series of having them engage the muscle and then release the muscle is really good.
That gives more. I was helping my daughter do that because she had 2 ligaments in her ankle that she got cut and tightened and screwed in. So she was like practicing her side to side stretching. So she gets my hand.
Yeah. Yeah. I'm so sorry. Yeah. So mechanically, to get your knee to cross midline, this muscle has to get longer. Does that make sense?
So can I just lay on my side and have like that roller thing your kids do it on me to do that? Like they do
yeah.
for running and stuff, the roller.
You can. If you engage your brain in the process, like that means pushing
Yeah.
against it, it helps. It will make the process faster. Breathe. Really focus on breathing.
Let me tell you what you're doing right here.
Okay, so right now I am, we'll do it on the other side and that will help.
Oh, okay.
But right now I'm on all the attachments of the femur where it sits in the acetabulum. And that's going to help.
The bottom tabulum.
The acid, oh,
I was chuckling over it.
We say like instead of asphalt, we say bottom fall, which is
Oh.
Jokes. Same
Fair.
little bottom.
okay.
Yeah, we don't say that word in our house.
Got it.
grassy bottom.
Yeah. TFL is very, very tight. Okay, now you think the only way out is through. Go towards it. If you fight against it, then it's not going to release. Go towards it, breathe. It's kind of like having a baby.
I know.
I wouldn't know.
You wouldn't know, but you have to go towards
When you
it.
said that, you're
Yeah.
like trying to avoid the pain.
Yeah, you can't. You just have to embrace it. Go towards it. The only way out is through. Yeah, breathe. You can see that she's getting more internal
So I see
rotation.
her knees moved way over.
It has. But we're a long way from done. Okay. I'm going to have you roll over and put your knee on. We're going to stack 2. Okay. Are you okay there? Okay. So your lateral hip rotators attach. Yeah, whatever is comfortable. Let's is that okay? Okay. So your lateral hip rotators attach from your sacrum to the femur. And as your hip internally rotates, they have to get longer. So we're going to work on all of those. And it's going to take some time. This is just not fast work. Now, if you were to do this on someone like 4 days in a row, then it won't take that much time by the 4th day because the muscles adapt, right? The change happens. But this is the first time we've done this, so they're going to take some time. Now, if someone's are very tight, that it's actually this outside bone of the arm you're using, not the elbow, until the texture starts to change, and then you can use a little bit more elbow.
The texture is changing.
You can feel it. It's less painful for them. You start to sink into the muscle a little bit more.
Okay.
You're working
Fully tenderized.
that, yeah. You're working with the tissue. It's not a fight. You're just working with it. So I'm sinking in further, so I'm going to use a little bit more elbow. So after we work today, it's going to be really important for you to maintain the length that we build, because it will get short again if you don't use it. So I will show you some exercises that are really important to do. Everything we do today is going to be range of motion. It's all going to be creating equal strength and length of each muscle around a joint. So we're going to be testing range of motion, making sure everything around a joint has equal length and tone. Is it feeling a little better?
Yeah.
Okay. So we're going to come back to this muscle. We're not done with it, but we've done the hardest part. Does that make sense? Okay. So we'll show this on the other side, but what I'm doing is I'm going to start at the sacrum, and I'm going to do something called a thumb chase, and you can do it like this direction, or you can turn, or you can do a combination of both. Now, if you try to do this just with your thumbs, you're going to hurt your hands. So all of my joints are unlocked. I'm not locking out any joints. They're all slightly bent. And I'm going to push my upper body into you. Does that make sense? So I'm using my body weight to push into the muscles right above or to the side of the spine. The side that's up above. Does that make sense? And I'm going to, so each of the vertebrae should have an appropriate amount of pivot up and down and side to side. Does that make sense? If one is locked, then the one above and below have to move too much, and that damages the tissue and the discs. So it's really important that every joint moves how it was designed to, so that the others don't have to compensate. So I'm making sure that the tissue on each side, well, right now I'm just working on your left side, but between each vertebrae can move. And I'm using my body weight. You can also use a knuckle. It's going to be different on different people on what you use and how much pressure. Yours is pretty locked up, so I'm using more pressure than I would on someone who's aren't. Does that make sense? Like on some of your girls, a tiny bit of pressure here is going to, like this, is going to be enough. But yours are a little more locked up. So I'm going to put more pressure. Ooh. And I'm going to come all the way up till I'm a little above your shoulders. And then I'm going to bring your arm, go ahead and relax. And I'm going to pull your shoulder down. Actually, I'm going to grab a little bit of lotion. And I'm going to I'm going to pull your shoulder down. So I'm cupping with my hand the top. Okay, of the shoulder. And I'm going to start like kind of where my hands are together. And I'm going to follow these scalenes up till I come to the occiput, the back of your head. And I'm going to trace all of these muscles to the back of the head. You have some important nerves, also some important veins here. So this is not some place that you like, this is not a static stretch. I'm gonna keep moving. I'm also gonna be really careful. It's really important to stretch these muscles, but I'm gonna be careful about the amount of pressure I'm putting here because there are important nerves, very important nerves, and important veins, arteries that come through here. But I also really want to stretch these muscles. I'm just going to be really gentle about how I'm doing it. Putting some pressure on the shoulder so that the muscles are on a stretch is going to help. If you have muscles that are locked at a certain length, then they can't adjust like they should. Every muscle should be able to get long and short and come back to medium. Does that make sense? Mm-hmm. And you want the muscles on all sides of the joints, no matter what joint it is, to be balanced in length and strength. Okay. So I'm also going to stretch from the medial delt to the elbow and do the extensors on the arm. You're always going to put a little bit of extra time on the attachments, on the tendons of the muscle. Then go towards it, breathe. Breathing. When you breathe, it's important for your rib cage to do two motions. If you're breathing into your belly, that isn't very helpful. You want your rib cage to do this as you breathe, and you want your sternum to do what they call a pump handle motion, to do this. So as you're breathing, get movement in your rib cage because you have a lot of attachments. All the muscles that go up to your head attached to the first and second rib or the clavicle. So you want movement in your rib cage. That's going to help those muscles release. Breathe. You know what? Let me put this under your head. Okay. So relax. I'm going to just circle shoulder. And then I'm going to put a little bit of pressure, which I know is going to be painful. So I'm going to, with my leg, I'm going to press your shoulder forward so that you don't come back. I want to stretch out this pec. And I'm going to put a little bit of pressure on the pec attachment, which is on the head of the humerus, as I gently, so gently, like you're working with a tissue, right? If the tissue says no, then I'm not going to go any further than it says. Does that make sense? But I'm going to put a little bit of pressure on that attachment as I bring your shoulder into a stretch, into an externally rotated position. Now, anytime it's really like I could have you push against my hand, engaging that muscle, and that's going to help the release happen more quickly. Okay. Now, I'm going to do a little bit of a twist here. I'm going to have you grab my forearm, and I'm going to grab yours. Now, I want, like we want our spine to have a little bit of lateral motion. So I'm going to have you inhale. I'm lifting with my legs, not my back, okay? So my knees are bent. I'm grounded into the floor with all the joints of my feet, and I'm going to lift with my legs. So inhale. Okay, I want you to inhale. Yeah. And now exhale. You got to really work on rib cage breathing. Really inflate your rib cage. Let's try again. Exhale all the air out. Exhale all the air out. Now inhale, inflate your ribs. Stretch each rib apart as you fill it. Okay. Now you're going to come back on your back, and we're going to... So now we're going to do the other side. Now, I don't know if you can feel the difference, but I can really feel the difference from side to side. This side has a little more play, and this one has none. So I know what we've done was good. So again, I'm going to press up on the quad. And as I'm putting pressure, I'm not using the heel of my hand so much, especially at first. I'm using further up, and I'm trying to move the muscle this way. Does that make sense? A little bit off the bone. A little bit. Especially as I get up.
Did you want me to make my knee in like the lumbar 4 thing?
Not yet. Oh, yeah. Okay. So now I'm going to, now this one, breathe, should be a little bit less painful. Good. Okay, I'm going to bring these over here. Okay.
Have you had any more marriages in your family?
Just 2. How about you?
No, my daughter was engaged, but she broke off her engagement.
Oh.
So my oldest 2 are married, but
Oh.
I still have a 24. Well, yeah, she's 24. And 22-year-old.
Yeah.
So the one that teaches swim, did he get married?
They have all taught swim, so but my middle one isn't married. It's
So
okay,
there's your
relax.
second one?
What's that? Yeah.
No, it's not married.
Yeah.
But the one that was Christian's age, he's married. I think
So my oldest, and Garrett's married with 2 kids.
Garrett's got 2 kids now.
Yep.
Met Garrett out with Tyler knocking doors
Oh, really? Okay, press.
a few years back when he and his wife both went out.
Yeah. Okay, so this one has way more internal rotation than your other one. So that's good. Maybe not quite enough, but more than the other one, which is good. So I'm just doing a little bit of tug of war. I'm feeling with my feet, are your hamstrings overstretched? I'm just kind of feeling the tone of your hamstrings. And there's a little bit of a tug of war as I'm stretching out your foot and knee joints. And then I'm going to place my foot on your sit bone. So I'm on the hamstring attachments. And every time I pull your knee forward or push it forward, my foot's going to slip further onto your sit bones. Okay. Okay, I'm going to place your foot here. Are you okay there? And I'm gonna... So with the other side, we could not do this. We'll go back and do it, but you just didn't have the rotation to do it yet. So now I'm feeling, I can feel your pec is really tight on the right side, but you do have a little more rotation on this side. Okay. So we're gonna stack these. I'm gonna have you turn to the side and is that okay? Yeah. Okay. Yes, good. Thank you. So you have more, like, your lateral hip rotators are more pliable on this side. So it's not going to take me as long to sink down in. And I'm going to use a little bit more elbow, but I'm going to really watch your reactions as I do it. I'm feeling as I go how much pressure I can put in.
So your third son's married?
Yes, they're
what's his
super
name?
young. Tobler.
Yeah.
Yeah. Yeah, it's exciting. Okay, not nearly as tight as the other side. So then I'm going to start at the sacrum, and I'm feeling for vertebrae that might be kind of stuck or locked. I'm just above each vertebrae, but I'm looking at the muscles that attach.
Is this the same Tobler that came over to taught her his piano?
No, that's Topher.
Oh.
Okay, I was like, I didn't know he was your kid.
Oh.
So not the same.
No, he doesn't play very well. He plays a little, but not a lot.
My arch on my right foot on the inside.
You feel it?
Here is kind of
Is it cramping? So I'm going to have you point and flex.
Oh no, that makes it worse.
That makes So a muscle cramps for 2 reasons. And the reason most likely that it's cramping is that it's not used to a certain length or being engaged in a certain way, or your brain literally can't control it. Does that make sense? going to hook my arm around, pull this down, the shoulder down. And I'm going to use a little bit of lotion so that I don't take the skin off of your neck. And this trap is really tight. Sorry, I'm pulling your hair. So I'm putting a stretch on the shoulder. I can put a lot of pressure down into the trap, but I'm going to be super gentle when I get to the neck muscles, the scalenes, the SCM. And I can even reach the levator from here, which attaches from the tip of the scapula right here. It's a great thing to do when everybody's sitting around watching TV. The more work you do with these, the less painful they get. And then I'm going to pull the arm up and put a little bit of pressure into the pec attachments. And I want to change directions, change lengths as I go. Again, I'm working with the tissue. I'm not trying to force, just encourage more length. And I'm putting quite a bit of pressure into your back so that I don't pull you over. And then I'm gonna, my palm is on your wrist, and I'm gonna kind of just pull these the ends of the muscles apart. Good. This medial delt isn't as tight as the other one, but it's still a little bit tight. Okay. Good. All right, so while you're there, I'm going to do a little bit of a twist now. So I'm straddling your legs, but I'm supporting your back also. So I'm going to inhale and exhale. I'm going to do it 3 times. Inhale. And exhale. Relax. Move your head side to side. And inhale. And exhale. Relax your neck. Okay. Okay, now I'm going to have you roll onto your belly.
Can you find a phone number that texted me recently about doing something tonight at 4 next week and ask him if tonight at 4 still works?
Okay, do you want to come down a little bit? Are you kind of, there you go. Okay, so we're actually stretching your quads in this position, which need to be stretched more than your hamstrings. We're stretching psoas here, also your back. Now, this is not something you want to do unless you feel super stable, okay? So I don't recommend it. So I'm going to hold here, and I'm going to put a little bit of pressure on the side, so I'm not on your spine, I'm the side of the spine. And I'm got most of my weight on my leg that's on the floor, but I'm going to put a little bit of pressure on your low back. Again, we want each vertebrae to move its fair share. So I'm feeling where they're not moving, and that's where I'm going to put a little more pressure. And then I'm going to put your legs down. I'm going to sit on your feet. But most of my balance is on my feet. I'm going to have you inhale and exhale. I'm going to pull my feet or your feet with me, putting a stretch on the quad. Inhale and exhale. And inhale. Exhale.
Why is stretching the quad more important than the hamstring?
Because most people's quads, especially if you run, are way tighter than your hamstrings, and that pulls the pelvis into an anterior tilt. So you want every muscle on every side of the joint. So you've got hamstrings that attach to the sit bones in the back, quads that attach to the front of the pelvis, and they are separate bones on the pelvis. So if you've got one dominant quad, then it will pull that bone anteriorly and not necessarily the other one. So you want to make sure that your hamstrings are as strong as your quads so that you hold your pelvis in a neutral position. Okay, so aside from stretching the quads, we are encouraging, I'm going to have you hold my hands or my wrists. We're encouraging, I'm going to pull you up. So go ahead and inhale and exhale. I'm going to pull you into cobra. We're encouraging every vertebrae to move its share. And then I'm going to do that 2 more times. Inhale and exhale. And inhale and exhale. Move your head from side to side, up and down. Good. Okay. So I'm just going to feel for So that's much better. Now I'm going to have you roll over onto your back again. And I'm going to stretch your hamstrings, but most people have hamstrings that are overstretched anyway. So I'm not looking to overstretch your hamstrings. Your socks are all, I'm pulling them off. So I'm going to feel the flexibility of your hamstrings. I'm going to see what kind of dorsiflexion you have, what kind of flexibility you have in these joints in your feet. And I'm also looking, can I put your hips into internal rotation? Much better than when we started. And I'm going to put a little bit of pressure on your hamstrings, but I'm not looking to way overstretch them. Does that make sense? If you had a posterior tilt to your pelvis, then I would be looking to stretch your hamstrings, which you don't. So I'm going to cross this one over. So this is external rotation. You have quite a bit of external rotation compared to your internal. So I'm going to put a little pressure here, but not a ton. To have both is really important. I'm going to have you push your knee into my leg. Good. 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 And then we're going to do the other side.
Can you text Rhonda? It might be there closer to 3.
Again, push this knee. And relax. Good. Okay, so this time I'm going to cross your legs. So that's pretty good external rotation. I'm going to have you hold my wrists. I'm going to be inhale and exhale. 2 more times, inhale. One more time, making sure you're filling your rib cage, stretching your ribs apart. So as we do these different stretches and you focus on breathing into your rib cage, it'll direct the breath into the sides, back, front, all the areas of your rib cage. Because it's very possible, I see it all the time, someone will breathe only in one side of the rib cage. And so that side of the rib cage will be at a more wide angle than this one. So as we do the different stretches, make sure you're breathing into your rib cage, and the different stretches will direct it into all different sides of your rib cage. Okay, hold my arms one more time. And I'm gonna pull you up. Okay, here's scoop. Okay, I'm gonna put a fair amount of pressure into your trap. This is an area we can spend a lot of time, and you can put quite a bit of pressure. Because I'm in the belly of the muscle.
Is that the hard muscles on top of my shoulder?
Yeah.
Yeah.
So,
Pretty much feel like bones.
yeah, but they're not. So I'm gonna move your elbow back and forth because I want to get into that muscle. And if I change the length and position of it, it's going to be easier to do. I'm going to have you breathe into your rib cage. And because these muscles attach to the rib cage, as you're breathing, that helps them to release, as I have one part of it pinned. This is a muscle you can spend quite a bit of time on. Try to relax. Okay, we're going to do the other side. So I've got your hand and my elbow with one arm. And I'm going to use the other hand to position. Now this side is really tight. Relax. To move the elbow. This side is going to take a minute, so we're just really going to relax and hang out. And you're just going to envision letting go. It is a learned skill to be able to do a body scan and say, where am I holding tension? And be able to just let it go. Good. You can do this on someone sitting in a chair. Works really well. Just like the brain educates the body educates the brain too. So when these muscles are really tight, there is no way that you can feel a total sense of well-being, because the message that your body is sending to your brain is that you're in trouble, that you are stressed. So to really be able to relax, to feel peace, you have to release these muscles. So there's tons said about mental practice to train the body, but it goes the other way too. You have to relax these muscles for the brain to feel relaxed. So I'm starting to sink down deeper into the muscle. But this one's really tight. Relax. Can you press your elbow into my hand? Relax, let go, and release. Okay. So I'm going to put both elbows behind your head. I'm going to thread my hands up through your elbows, and I'm going to lift. Now, this may not be something you want to do, but I like to do a little bit of a twist. You've got a lot of stiffness in your thoracic spine. Okay.
Jiu-jitsu meets yoga.
Right? That's right. That's what Thai massage is. Okay, so I'm going to cup my hands and I'm going to grab all of the tissue at the back of the neck and into the back of the head and just pull it through my hands.
Are you squeezing your hands together?
Just like this.
Oh, okay.
My fingers are interlocked and I'm just squeezing the tissue between my hands. This is also a great place that you can hold the occiput, the back of the head, and the forehead, and just work those attachments super slow. I'm not on the spine, I'm just on those muscles that attach into the back of the head. You can also, I'm going to move your hair so we can see. It's a good time to work these muscles. It helps to brace their head. So I'm going to hold the head so I'm not pushing you too far forward, and I'm not.
That on myself.
Yeah.
I just go right here and then I just
Yeah.
pull up on the opposite side.
Not on the spine, just to one side of it. All those.
He gets migraines and headaches, so it like demands. You know,
Yeah.
I just have a tight neck, but it doesn't go until headaches are right.
Right. Same thing over here. Good. I'm going to have you hold my wrists. And this is more of a thoracic, upper low back stretch. And my feet aren't on the spine, they're on either side. And I'm using my big toe joints to put pressure. Make sure those vertebrae are moving. I want you to breathe into my feet. Just want to make sure that we can breathe into the back of the rib cage. I can leave one foot there, and this little bit of a tug of war, I can come up a little bit higher. Make sure those ribs are not stuck, and I'm just putting a little bit of pressure. You can even come up to the shoulder blade. You have to leave one foot there to hold the person in place. And just breathe into my feet. Okay, how are you feeling?
A lot looser.
Yes, you should be a lot looser. Yeah.
If you think there's something else you want to cover, I can pay you a little extra if you think there's something else you
So the thing with runners is the quads. I'm going to spend just another minute on. So while they're laying on their belly, and the psoas, quads and psoas get tight. So you want to make sure that you're stable, and you don't have to, you can do it just where you kind of sit on their feet and stretch the quad and put a little bit of pressure on the low back. But runners, psoas and quads get really tight. But also these neck muscles get so tight. So this is a great stretch for anyone. And then palm pressing the quads is also really great. And then making sure they have internal rotation is really important. Because runners tend to have good external rotation and not internal rotation. If the quads get dominant, you end up with plantar fasciitis issues. So,
what does the quads being dominant mean?
If they overpower the hamstrings. Because what they do is they'll tip the whole pelvis forward. We're not talking much, right? A few millimeters. That overstretches, because if the front of the pelvis comes down, then the back of the pelvis comes up and overstretches the hamstrings. And that tissue is all connected, so you're overstretching it to the bottom of your feet. And so people stretch and stretch and stretch the bottom of their feet, but it's already overstretched. So that's not the problem. The problem is release the quads, bring the pelvis back into neutral, and then all of a sudden everything feels better. It's all about balancing length and strength on every side of a joint. Okay. So you also want to work on external rotation of the shoulders. So let's just go through a couple exercises for that, okay? You can lay on your belly. I'm just going to show you.
Okay.
With your arm out to the side,
Look, am I looking at this arm? Or, yeah.
this one.
Okay.
So,
Like this?
no.
Like this? Okay.
And the goal is to stretch the pec. So, now engage this muscle by pressing it into the floor.
Okay.
You should feel that in your pec and in your and like bicep. Okay. So that's a good one. You can also take a stretchy band or a stretch strap. They both work, whatever you have. And do, I'll let you use that one. So you have to have, you're going to have to go wider
Okay.
at first.
Just
So,
on the back or go over my head?
so
Like this?
yes, and then all the way down.
Should I try to go slower for that part back?
Yes, go slow. And if you have to go wider with a wider grip, then do it. Now, the two things you want to watch with this is that the range of motion isn't coming from your spine. So engage your core, don't move your spine. This is all shoulders. Yeah. So before you were getting that rotation by extending the back. We don't want any back extension. Spine stays neutral. And does that make sense?
Elbows stay straight. So that I'm noticing her in there.
Oh, well, either way will be okay. Okay.
Okay.
So that's for shoulders. You can also go ahead and put it in, so hold it behind you, palms facing backwards. And you're going to come over and stretch. This is really important because it eccentrically loads the pecs. That means they're engaged but long.
So I go like this?
So your palms need to be facing backwards. So there you go.
That one?
So you can do it standing, but you can also do it kneeling. Now pull the strap apart so you engage your rhomboids and eccentrically load your pecs. So pulling, and then when you come up, don't let your arms fall. Hold them up really strong.
Oh, I can't.
You can't get up. So that is a good core exercise, which you should definitely do as well. So,
I don't know if there's a guy that could get up.
yes, you can.
I don't know about me. I've got short legs.
You can do this standing. I usually do, actually.
Oh, okay.
So you can come over, bend your knees.
Yeah, I could do that.
You can do this
If I
one.
was on my knees, I think I'd be stuck.
So come over, pull the strap apart, pull. Really feel the engagement of your rhomboids between your shoulder blades. And then as you stand up, don't let your arms fall. Try to keep them high.
Okay.
And then come down. That would be so good for you. So good. Okay, then I want to give you an exercise for internal rotation of your hips. So let's move this out of the way because you'll have a hard time balancing on it. Okay, you're going to go 1 foot forward, 1 foot back. This is hard to do in socks. It's way better barefoot. Okay, do you see the angle of your heel? So you actually want it to go, you want to move it towards the wall. So that lines up your hips. So good. Now your hips are square. You can hold onto a chair, you can use a stick. Okay, then you're going to load your front leg. I'm going to go to the same leg you are. Okay. So, and you're checking in. Don't let that heel, keep it towards this wall. Does that make sense? Grip the floor with your feet. This is way better barefoot. And load, so both legs are unlocked, but you want 70% of your weight on the front leg.
Okay.
And then you're going to turn into other way. Okay, so now can you come up just a tiny bit? There you go. Now these lateral hip rotators are long and you're in internal rotation. And it doesn't have to be far. Okay, watch the heel. It's really hard on a slippery floor. Barefoot is better.
Now you gotta just put your arms out like that. You're warrior one.
And there, so the idea is to stretch your lateral hip rotators and then go back and forth. Does that make, so you're folding into, and the spine isn't moving. There's no twist of the spine here. It is all hip. And you'll feel, as you come back, you'll feel your adductors engage. You'll feel all sides of your hip as you want to make sure all the joints of your feet are gripping the floor. And then let's try the other side. So the things to check in, okay, where's your heel? Are your hips square? Then you're going to pivot like you're going to look over a cliff. Your heel can come off the floor about an inch on the back.
On the front?
Back foot.
Okay.
And square up your hips by moving that heel out. So this is the one that has a harder time with internal rotation. And then you're going to look, your spine doesn't change, just the rotation of your hips. Socks are going to make this really hard.
It's too high.
So you want your heel about an inch off the floor, both knees unlocked, most of your weight in the front leg, super stable, spine isn't moving. So things to play with.
Something like that, I could do it.
Yes, a chair absolutely
It's like my
help you
finger
be
in my hand.
stable.
It's like, okay, I can balance.
Yes, but that is going to help your hips be able to do internal rotation. Something to play with. And the more you do the exercise, there's subtleties of the exercise. Does that make sense? You'll get better at it.
Okay.